Good afternoon, everyone. Thank you for joining us, and welcome to our webinar today, Friday, the 27th of March, around supporting employees with disabilities during the COVID-19 period. My name's Andy Rigby. I am the Regional Manager for Posturite in the North and also our National Enablement Lead. It's probably the most amount of homework as we've had on a webinar of ours in these hugely challenging times. Thank you for taking the time out to tune in or listen again on the website. We are delighted to be joined by Adrian Ward, who is Head of Disability Partnerships for the Business Disability Forum. Before joining the BDF, Adrian led a diversity and inclusion experts team within a large civil service organisation specialising in all areas of disability, in addition to leading public sector equality duty work. Now he leads the teams responsible for all relationships with business disability forums, members and partners. Adrian is also a qualified mediator with nearly 15 years of conflict resolution experience and has since developed a neutral diagnostic tool designed to help organisations resolve disability-related complaints, grievances or systemic issues using a constructive, blame-free process. As ever, there are opportunities to ask questions at the end of this session, so please send them throughout the presentation as they do come to you, and we will field these to Adrian at the end. I've been told to say if there are any issues with sound as well. As I mentioned, we are recording this, so this will be uploaded on our website later today. So a lot's changed, Adrian, since we met in London in Starbucks a few weeks ago and discussed putting this webinar together. I thank you for adapting and bringing this right up to date in line with the current situation. I know you've been inundated with questions and how to handle this. So without further ado, I will hand over to Adrian.
Thanks, Andy. I really appreciate that. And hi, everyone. I suspect this is one of the webinars with the most people ever working at home. I myself have banished my son to another room so he doesn't come in and ask about maths homework or anything like that as we go through this. So just a little bit about myself to start with. I head up the Disability Partnerships team at BDF. So essentially we look after all our external relationships with members and partners of BDF from our team. And with this webinar today, I've tried to do a couple of things really, because some people had registered when we first put this out, where we were going to be talking purely about making adjustments. And then with this ever evolving situation that we're in, Andy and I decided earlier in the week that we just evolve the content a little bit. So we talk and focus on the particular issues that COVID-19 is throwing up for organisations at the moment. So it's a little bit of a mesh of two bits of content, but I'm sure you'll see the relevance for that as we go through. I just wanted to start with a little bit of information about Business Disability Forum itself. Give me a second. So Business Disability Forum is a not-for-profit membership organisation. We've been around for just under 30 years now. And essentially we exist to help organisations improve how they essentially attract, recruit and retain disabled people. Help organisations think about how they do business with people in terms of delivering their products and services. Thinking about how organisations can increase confidence, accessibility, productivity and profitability. BDF represents around about 324 organisations who are in our membership, and we estimate that membership employs around 50% of the UK workforce. I do apologise, I'm having slight difficulties changing from slide to slide here at the moment. So the focus of today's session is to look at adjustments and workplace adjustments. So the first thing I really wanted to touch on today is actually this concept of adjustments. What do we actually mean by that? Most people will be familiar with the concept reasonable adjustment, which is the language that the Equality Act uses. At BDF, many years ago, we started to evolve how we use that language, and we actually use just the term adjustments or workplace adjustments. So that tends to be the language that we will use. An adjustment essentially is that requirement for an organisation to change or adapt something that they put in place for an individual in a working context. So I've just split this into the sort of 3 areas that the Equality Act would focus on, to give you a bit more context around that. So as an employer, they're a duty to make adjustments to the 3 following areas. The first is around the provision, criteria or practice. So by this, we're talking about things like a policy or a process that exists within an organisation, such as attendance management or a parking policy, for example. There's then a requirement to look at physical features and making changes to physical features. So again, I've listed a few examples there. Things ranging from access to a building, signage and wayfinding within a building, and kind of all those facilities that are available to people within that building. So that could be from your team meeting rooms to your canteen, to a gym that might exist within your premises, etc. So it's just thinking about all those physical features that exist within your environment. And an organisation also needs to think about the provision of auxiliary aids. So again, by that, I've given a few examples of what we mean by an auxiliary aid there. So that could be things like hearing loops or induction loops. It could be things like the provision of BSL, British Sign Language interpreters. But essentially, it's encouraging organisations to think about and fulfil that duty to make adjustments in these 3 areas. Now, I wasn't going to put this slide in originally. This was going to be one of the slides that I lifted out of this presentation because I wanted to get more focus on the COVID-19 side of things. But actually, in the last couple of days, I've had 3 members of BDF approach me asking particular questions about their adjustments processes. And I think what I'm seeing and what I'm hearing is that the current situation has made organisations think a little bit about how they provide adjustments to their employees. And although actually getting stuck in and changing workplace adjustments processes at this point in time might not be an absolute priority because there's so many other things going on, what I'm hearing and what I've heard from members that approached me this week was actually this is going to be a priority moving forward, and this is going to be an area where these organisations really have recognised they want to essentially up their game moving forward. So I've included this slide in here. This is the sort of process model that I use if I'm working with an organisation to get them to think about how they might improve, how they make adjustments for their employees. So I work in sort of 6 areas of which I'm encouraging an organisation to think about. Moving from the top of this chart here, the first one being the commitment area. So this is where I'll work with an organisation to get them to think about what's the commitment, what's the senior buy-in to making adjustments for employees. So what are you actually articulating and communicating to your workforce about actually the need and the requirement of making adjustments available and putting them in place for employees. So we'll do some work with organisations looking about what that commitment looks like. We'll then look at existing policies within an organisation. So what policies or processes does an organisation currently have in place? How does that currently work? Are there pinch points? Are there delays? Are there areas where people might not be getting the adjustments they require at the speed that they require? So we'll look at what policies say. We'll then start looking at what the processes are also showing us. And within that, looking at where there might be pinch points and delays. Another big area to focus on is what I've called here know-how. And essentially what I mean here is the level of awareness and confidence around disability and making adjustments across the workforce, particularly with people in HR roles, diversity and inclusion roles, and people managers. So anyone that's in a line manager function in some shape or form. We look at and we explore how organisations can increase that level of awareness, because essentially workplace adjustments and then putting adjustments in place normally start with really healthy, rich conversations between the individual and their line manager. So the more confident a manager feels, the more likely that adjustment conversation is going to be a productive one. I then use the word control there. I could have used different words, but by control I mean helping organisations think about key performance indicators, service level agreement with any providers of equipment, for example, but also helping organisations establish a real comprehensive management information picture. So do you know how many adjustments requests there are, the frequency, the type of adjustment, and actually things like how quickly are people getting adjustments in place. So I'll always be keen to work with an organisation to put those sorts of measures and metrics in place. And then the last box, I've put end user there, which sounds a little bit impersonal, but what I mean by that is actually keeping regular feedback and dialogue with the individual that requires that adjustment, making sure the process works for them, and seeking their feedback on how things can be improved, essentially. I included this slide because actually I would hope that these are 10 points, or even if there's 2 or 3 of these points that people take away and think about, that will be a good takeaway from today's session. And this is really helping organisations think about what are the steps that could be put in place that will make a workplace adjustments process more efficient. So one of the most common areas we focus on is absolutely around how adjustments are funded, and actually conflict and disputes around how an adjustment is funded is probably the most common delay that we experience. So actually deciding how things will be funded and putting that in place is really important. We see the most effective workplace adjustments processes where there's a dedicated resource in place. So whether that be a workplace adjustments officer or a central point of contact or whatever that might be, but just having somebody that has oversight of the process end to end. Having policy and clear guidance is really important. That provides your framework and that provides your point of contact for most people across the organisation, seeing how the process actually works to get that adjustment. So having that policy and communicating that is really important. As touched on, making sure that the end user is funneling into the process to a single point of contact. One of the areas we see adjustment processes go wrong is where there's too many entry points into the process, and it can be very confusing for the employee or the manager. So the simpler the process, the more effective it's likely to be. It can be really useful to build some sort of catalogue or log of regularly requested items, so that actually if there's bits of assistive technology, if there's software, if there's pieces of furniture, etc., that are regularly required, and there's mechanisms to quickly order those through a process for a catalogue that exists, that can massively speed up implementation times. Really useful to have a clear escalation process. So again, sometimes there will be some complexities in putting an adjustment in place. If you can actually find a way in which that issue, that particular case is escalated and discussed and resolved, that will take out some of the big delays that exist with putting adjustments in place. So having clear escalation processes can be really helpful. There will be times where you won't know the answer, and actually it's really important to just seek that additional input from somebody else. So I'm sure most of the organisations you work with, you'll have occupational health providers in place, you may have ergonomists in place. I've given a bit of a plug for Handy and Posturite there, but they are an expert provider and they are an organisation that can help you with your adjustment needs and requests. I'm sure Andy will be pleased with that. Important to build awareness amongst key stakeholders. So I've said people managers there, but by key stakeholders, I mean basically anyone that might be involved in an adjustment process. Could be IT, could be procurement, could be facilities and building estates, could be HR, but there will be a number of people that will have a role to play in actually making an adjustment happen, make sure their levels of awareness are good. Always important to record and review adjustments. That helps you build that management information picture. It also helps that continued dialogue between employee and the organisation and make sure that adjustment that's in place is effective. And that final point, which I touched on the previous slide, is have that continual improvement cycle where you're seeking feedback from the users, whether that's the line manager or the employee, and using that to inform your processes and refine your processes. So those slides really were to give a bit of an overview to the workplace adjustments sort of concept and how you can make that as efficient as possible. As I mentioned at the start, I wanted to then mesh this a bit more with some specific information around the COVID-19 situation. So I built a few slides just to focus on that in a bit more detail. And a lot of what I talk about here is based on some of the queries and some of the issues that are coming up to us through our BDF advice service, and just through questions that have come up on webinars that we've run as well. So it's providing some feedback and some insight that we're sort of picking up on at the moment. I think one of the main things to consider to start with is the particular nuance of this situation is it's not just people working from home, it's people being told they have to work from home. So there's a degree of just having to adjust to that mentally of this is an enforced process, this isn't a choice at that stage. So I've listed a few things here which are coming up typically as questions that we're focusing on. If I take the first two, technology and office furniture, I'll take them together just because there are some similarities there. So one of the things we're seeing around this is an issue of people that might need specific equipment at home and not necessarily having that set up. So they're not set up to work from home essentially because they don't have their IT equipment or their particular furniture that they require. So one of the things we're asking and we're getting organisations to think about is firstly, is it possible to safely transfer equipment home? Can that be done without then necessarily needing to be interactions between people with that? So couriering equipment to people's homes and perhaps supporting installation of equipment remotely might be something to consider. I actually had a conversation just before this call, this webinar, with one of our members who actually gave an example where they'd made the decision to send people home a couple of weeks ago, and their employees that had particular pieces of equipment like ergonomic chairs or other bits of equipment actually took those with them. It wasn't an instruction by that organisation, but people just made that choice to do that. The person I was speaking to actually thought this might be a bit of a problem, a bit of an issue, but actually they solved a problem by doing that, because those people have actually got their equipment at home because they took that decision to take it with them at the time. Now that's not going to be possible for everyone, but in that particular situation for that organisation, it's actually helped get a lot of adjustments that people would have had in the office replicated and set up at home very quickly. We're hearing that some providers are doing workplace assessments remotely via video conference. So that's enabling some support to employees working at home, looking at that working environment that they might be based in their home environment, and providing some assessments and some feedback and some solutions as a result of that. Not all providers are doing that. So if you do have a provider that provides those workplace assessments, check in with them, see what they can offer, because if they are offering that sort of consultation, that's a massive support potentially for people that are working at home at the moment. Have a think about whether some adjustments can still be attained via a self-service process. So again, some of the organisations we work with, they will have a mechanism where staff can actually order some adjustments, normally some of the more basic adjustments, but they can order them through a self-service portal. If that's still possible, then that gives you that tool, that mechanism to be able to put adjustments in place for people working at home. Have a think about if you've got particular restrictions or limits on ordering pieces of equipment. This might be a situation where there's a merit and some justification in sort of slacking in some of those restrictions, maybe not making people jump through procurement hoops to get a piece of equipment that they require. Now, I say that with a recognition that you still need some checks and balances. It can't be a free-for-all, but it could really help speed up the implementation of an adjustment if people have got the ability just to step outside the normal process. Particularly at this point in time, because, and I'm sure Andy will probably echo this, the demand for adjustments, because you've suddenly got this big wave of people that are now working at home that haven't been previously. The demand for some of these adjustments, these pieces of equipment, furniture, IT related adjustments, etc., has gone through the roof quite quickly. So that's an issue, that's a challenge. So any way in which you can loosen up the process and get things to people in a quicker format is definitely worth considering at the moment. And everything I've said there comes with a caveat that absolutely no arrangement or solution that gets put in place should exacerbate or inflame an existing condition, or indeed cause a new problem for an individual. So that's where still having access to occupational health, remote assessments, etc., is still going to be really important to make sure you're not putting anything in place that might be causing a future problem. So that's just a caveat I wanted to touch on there. You'll see the next box along, I've mentioned licenses. So we have heard a couple of examples where people might have particular licenses for pieces of software, assistive technology software like Dragon or JAWS, for example, which might be assigned to a particular computer rather than a particular user. The good news in terms of what I'm hearing about that is that there's been particular feedback that most providers are being quite flexible with this. So actually they're extending the licenses so that people can use them on multiple systems, which is always something that is available, but that's not always put in place for individuals. So there's some flexibility there with providers. Again, I think that's one where you've got a provider that's giving you that sort of assistive technology, check in with them, just see what the arrangements currently are and what provisions can be made. The final box, which I've put a cheeky plug for one of our publications there, Meeting Matters, but actually the major point of which I want to focus on is this whole concept of remote working and the challenges that's throwing up. So that, again, this is based on some of the things that we're hearing at the moment. The first thing really is there's a lot of people that are in quite a big adjustment phase here of getting used to working from home. So that's massive for people, just getting used to that concept that they have to do this. We are seeing a massive increase in the use of video conferencing, which is good, which is making sure people are really being able to join up as individuals and teams. But we do know that some of the video conferencing tools have some accessibility challenges. The good news with that is I saw that this week, in fact, Microsoft Teams have just released an update which has provided captioning on Android and iOS systems as well. So it's one of those areas where it's constantly evolving and the providers are constantly improving the accessibility to these services. So there are benefits, it is working well for people, but there are some accessibility challenges that need to be overcome as well. Where you are using video conferencing, it is still possible to use sign language interpreters, so BSL sign language interpreters. What I would say with that is they will tend to get booked up quite swiftly. So you need to plan ahead with that and make sure that people are available to provide those services for you. So it's just something to think about if you are going to use an sign language interpreter, factor that in and plan ahead essentially. One of the things I did want to flag today particularly was factoring that difference of the different home working environments that people have got at the moment. So we touched on earlier the fact that there's a lot of people working from home that might have kids at home as well. That's going to have an impact on productivity. So it might be something to think about. Can you stagger your working hours for people in your team? Do they all have to work 9 till 5, or actually can we be much more flexible here and allow that balance of the sort of the childcare element and work to work in unison? It's definitely something to think about at the moment. Another one that's coming up, which might not surprise you if anyone else is struggling with this at the moment, is the real pounding that internet connections are having at the moment. So there is a real need to think about structuring your day, perhaps even putting timetables in place as to when you might need a good internet connection more than somebody else might in the household. Even going back to basics of putting an Ethernet cable into the system and using that if you've got a particularly crucial call or meeting that you need to use, and don't want your internet connection to be not at its optimum. Also have a think about some people's access assistive technology might not actually be accessible for some of your IT systems remotely. So that might lead you to have to think about some temporary adjustments to people's work to reflect this, because actually if they can't access some of these systems, you do need to think about other things for them to be looking at during that period of time. Some wider considerations. I mean, there are so many wide and far considerations that COVID's thrown up, but I just wanted to flag 3 or 4 things just to think about. Attendance management has come up as an issue from a few people. We've had questions around this. I mean, we're essentially saying, given the current situation, the real good practice here is just to amend your absence procedures and really think about disregarding COVID-19 related absences. What you don't want is not being flexible with those processes and people actually feeling that they need to return to work whilst they're still not 100%. And obviously in the current guidance, in the current situation, that really shouldn't be happening. There might be a need to think about redeployment. So moving people to different roles for a period of time, onto different projects, for example, which will enable them to continue working, just doing a different role for a period of time. In a similar area, but slightly different to redeployment, it may be that an individual can do maybe 80% of their job from home, but can't do the full range of those jobs. So there might be an element of just carving up the job, reallocating certain duties to people to just ensure that they're meaningfully engaged and able to work from home for a period of time. I also put furlough on there as well, because that is obviously something that's on everybody's radar at the moment. So I just wanted to really reiterate some points around furlough. So this is a possibility for organisations to consider, but we're saying to people really carefully explore this and consider this, particularly when it comes to disabled employees, and to think about avoiding discrimination claims from disabled employees in particular. So it's something that has to be very, very carefully considered. Essentially, employers can place employees on furlough leave if they were otherwise going to lay them off. They definitely would then need to discuss that with an employee, make it clear that they would remain on the payroll and that they're not redundant. If somebody is placed onto furlough, they cannot undertake any work for you during that time. That's a very clear stipulation of that. If they are placed onto furlough, can claim a grant of up to 80% of the employment costs. That is capped at a limit of £2,500. Again, if you are going down this route of furlough, information around furloughed employees needs to be submitted to HMRC, and there's an online portal that's been put in place for that. Initially, this arrangement's in place for the 1st of March to the 1st of June, but there will be scope to extend that, we're being told through government advice. And then the final area I just wanted to touch on today, and I think this is going to become increasingly an area which there needs to be a focus. So much of what I've spoken about is about practical, tangible bits of equipment, solutions, adjustments to put in place. But we also need to think about the well-being of people in this unique set of circumstances that we have at the moment. So I've put a few things down here which I think would be really important for organisations to think about. Firstly, it's trying to agree that and get that balance of the right level of contact and frequency for catch-ups with individuals and your teams. I don't think there's necessarily a wrong or a right answer for that one. I think it's being led by people, by teams, by individuals about what is that right level of contact. But it's important to establish something which is regular and making people still feel part of that team. Thinking about different modes of contact. So as well as using systems like Microsoft Teams and traditional telephone conferencing systems, etc. From an informal point of view, things like WhatsApp seem to be really popular in terms of just keeping dialogue going, and that office conversation, that office chat, which just goes when people obviously can't work in an office for a period of time, but just trying to keep that informal dialogue, keeping people together and having those conversations, I believe is really important. I think having really proactive occupational health services and really clear wellbeing initiatives will just need to be continually ramped up over the next few weeks, really getting people thinking about their own well-being and things that they could or should be doing to help with that over a period of time. I know not everyone particularly likes the phrase pastoral care, but I think there is definitely an element about thinking about those mechanisms that as an organisation you have in place and how they can support people. So EAP, for people that aren't familiar with that, employee assistance programs, MHFA is mental health first aiders, but really any support mechanisms you have in place that are there to provide guidance, information, in some cases counselling support. Just make sure that employers are fully aware of those and can still access and tap into those as often, as regularly as they want to. I think sharing a good practice is going to be really important. I think everybody is in a completely unique set of new circumstances here, and again, the grips with the different challenges it's throwing up. So I think things like these webinars, and there's lots of information that's out there at the moment, tapping into that information, that good practice, and sharing that amongst your workforce and other employers, I think it's going to be really important over the next few weeks. Definitely, I think that element of people switching off, there's a real danger if people are working at home that the tendency is to stay switched on, that the laptop stays on or the work phone stays on, and people don't necessarily take that time away from the desk, from their working environment. So really helping people understand how they can switch off will be really important. And things like taking annual leave as well is going to be really important, because the danger again would be people just don't take their leave and just continue working whilst they're at home. So it's encouraging people to think about how they strike that right balance of working and time away and switching off, etc. There's lots of guidance out there about the perfect way of working from home, what people should and shouldn't be doing. My experience and experience we hear from people is actually people have to find their own way of working. So there is guidance, there is to help people understand what they could or should be doing, how they can remain fit and healthy, etc. But in terms of how people work, I think people will need to adjust and find their own way over a period of time. And the last point I just wanted to flag today as part of this session is actually don't forget your people managers, the people that are supporting the workforce, the people that align managers to people that are working from home, because they have their own anxieties, they have their own concerns, they will have their own challenges of how they work with their teams and keep their teams together, communicating, etc., etc. So they also need support as well. So there's a real need to not forget the people managers, the HR professionals, the D&I professionals as well within this, and get that balance right. I appreciate that's a whistle-stop tour through adjustment and some COVID specific content. We have created some space for questions at the end of the session. So Andy, if I hand back to you at this point.
Yeah, thanks, Adrian. Yeah, we've got a few questions. There's still opportunity to send them in. I know a few of you have, so keep sending them in if you've got a few questions. There are some sort of quite specific questions, so forgive us if we don't read them out, and maybe Adrian, I'll send one or two through to you if that's okay, to maybe get in touch, because there's quite a few specific ones. One of them, which is probably a great place to start, is what is the biggest challenge for employers supporting disabled staff during the current pandemic?
Okay. Well, I think the very immediate challenge is the speed of meeting the demand of the requirements and the adjustments that people will need, because how everything around COVID-19 has moved so swiftly, and actually how it changes so rapidly from day to day, it's really left organizations having to think on their feet very quickly and respond very quickly to situations. So, example, decisions to say to workforces actually don't come into the office from today or from tomorrow. That's a very swift and immediate impact, which normally an organization would probably spend weeks determining whether that's the right course of action to take. We just haven't had the time to plan through those sorts of decisions. We've had to make quick and snap decisions. What that means for disabled people, particularly people that need adjustments, is the speed of being able to react to that decision and put those adjustments in place is a real challenge. And I think that's going to be the bit that's going to be a challenge now and perhaps over the next few weeks of actually how do we put things in place for people as quickly as possible? How do providers, how are they going to be able to meet the demand, which is really going to peak over the next couple of weeks? So I think there's a real message about getting things done now, because this is the time to really put things in place. So that's the biggest one, about the speed and the meeting of the demand, which has gone from sort of 0 to 60 overnight, essentially. I think the next wave, the next concern that I would see, and the bit that I think organizations really need to focus on, is a bit what I touched on my last slide, which is that this whole element of the anxiety and the isolation that people will be facing for many weeks now. That will impact on people that have already got underlying mental health conditions. So it might be exacerbating some of those conditions, but it will also create new instances of mental health as well. So there's that whole element about organizations being geared up to support the mental health and well-being of their employees as well. So I think it's a couple of things, Andy. I think it's the speed of response and being able to get things in place quickly and effectively for people in terms of their adjustments, and then the longer term impact of mental health and well-being and making sure that's being supported and managed as effectively as possible. It's difficult enough for managers to do that when you're in a working environment and you've got day-to-day contact with people and you can see people. When you're having to do that remotely and get that pastoral care right as well, that's a huge challenge and something that we're really going to need to get to grips with as a nation.
Right, thanks, Adrian. Yeah, and I'd just add as well, just on that, just talking about earlier the demand for reasonable adjustments. We spoke earlier about supply chains are going to being brutally honest, they're going to reduce over the next few weeks, and obviously this situation is changing so quickly. From what we're seeing, I would encourage people to act sort of sooner rather than later, if that makes sense, in terms of reasonable adjustments for people, because we don't know what's going to be available in a few weeks' time. It's just absolutely something we can't predict. We've got another question. This is one we've spoken internally about, actually. So do you think moving forward employers are going to look at more a flexible approach to working post COVID-19?
Absolutely, yes, I would say to that. I think one of the things that this is highlighting for some organisations is that the ability to still operate as close to business as usual as possible with a workforce that's working remotely has really been highlighted, that it is possible. I think it's showing that different ways of working, remote meetings, etc., actually that is possible, is effective, can still really make organisations work harmoniously, etc. So actually that might have a positive impact in terms of disabled people and employment moving forward, because if it helps organisations think about how much could be done working remotely, which historically might have been a barrier to employing somebody with a disability that might not be able to travel into the office day in and day out, there might be a real positive and a real opportunity coming out the back of the COVID-19 situation in terms of employment for disabled people, and actually how that remote working means that people can work just as efficiently, just as effectively.
Great. I'll fire through a few because they're coming thick and fast. If a worker has Parkinson's disease, what challenges are they likely to experience?
That's quite a difficult one to answer in terms of, are they assuming they're coming specifically from the COVID-19 angle?
I would imagine so. Yeah, that is the question. But yeah, I know it's difficult to know what the individual's doing, etc. But yeah, I would go with that angle.
Yeah. So Parkinson's disease does come under the vulnerable group. So it's listed as one of the conditions that was put out as the group of vulnerable people. So there's that implication straight away. So they are a group that needs to be very much in this self-isolation and not exposing themselves to any additional risk. So there's that angle as well. Obviously, if they are able to work from home and can do that in an isolated way, then that shouldn't really have any implications on being able to do the day-to-day job. They may need particular adjustments. Again, it would depend on the extent of the Parkinson's and how that's impacting on the individual. So that would be a consideration about actually, by working at home, does that create any additional barriers to be able to do their job that they weren't experiencing previously? If they are, and it's a case of identifying what those barriers are and seeing if there are adjustments in place that can remove those barriers. So it's quite difficult to give a very specific answer to that one, but overall, Parkinson's does come under the vulnerable category, so that needs to be a consideration there straight away. And then it's considering about those additional challenges that might be placed by that individual working at home and how those barriers and challenges can be removed through potential adjustments.
Great. Another question, do certain mental health conditions fall under the term of disabled? I know you touched on mental health just, and what provisions might be useful now?
Yeah, okay, so I deliberately didn't include a slide at the very start, only because I was trying to fit enough into the time that we had available for the webinar. But yes, if you took the definition of the Equality Act, it's very clear that both physical and mental health conditions are covered by the Act. So the very broad answer to that is yes, in terms of the mental health angle. I think it's about, in terms of that, the support for the individuals, it's about maintaining the right level of support for people with mental health conditions, and that will vary depending on what that condition is and what's required, etc. But that will be a combination of two things, really. It will be through the internal support mechanisms that you've got. So that will be the line manager's responsibility in terms of keeping in regular contact with that individual. It will be through the sort of pastoral care channels that you would have existing in the organisation. So if you've got internal counselling services, for example, employee assistance programs, mental health first aiders, occupational health providers could have a role to play in that as well. So there's almost a package of support that could be available for individuals should they need that. Again, depending on the condition, there will be all those external support packages as well. Now, that's where it does become a bit more challenging, because some of those external provisions are and will be particularly stretched over this period of time. But I'm thinking things like, your local counselling services, local mental health support services, etc. It might be worth plugging at this point Remploy's mental health support service, which is a government initiative and is available for any organisation and employees within organisations to contact, and they will provide support to individuals around mental health and supporting people in the working environment. I wonder, Andy, if that's something we can just pump out some information afterwards, just to steer people towards that.
Yeah, sure. 100%. Yeah. Yeah, great. Another question, it's one that we field quite a few actually internally about assistive technology. So obviously there's a lot of people that will be using assistive technology in the office that now are home workers, and whether that is now available to them or not. So the question is around Dragon software. You mentioned Dragon software being flexible on licenses so people can install at home. Do you have any specific information on this? Do people need additional licenses, Adrian, or can licenses be transferred? I think that's probably a big one, isn't it?
Yeah, it could be a bit of both. I mean, it could be a case of an organisation considering purchasing additional licenses and more licenses for an organisation, because essentially the potential that there's going to be many more people using that sort of software working from home. It may be simpler than that, particularly on a case-by-case basis, where you can just go back to the provider. So there will normally be a provider that an organisation's working with. So Text Help, for example, would be a provider that organisations work with, and just talking with that provider to see whether they've got flexibility around extending the licenses that are currently in place and in use. We're definitely getting some positive feedback on that one. I mentioned in the presentation that we're hearing that organisations that are providers are giving some flexibility around that. So my first port of call, if I was in somebody's shoes that's asked a question, there would be to go back to the provider of the license in the first place and have that conversation with them, just to see what flexibility might be there. If there isn't, then yes, it might be a case of purchasing additional licenses.
Great. Quite a couple of questions on virtual meetings, which is obviously going to be a big thing in the next few weeks for productivity, for sanity, etc. So one of the questions are, regular virtual meetings are being recorded more and more often. How can we put captioning easily on them? Is there an easy way or an easy program for people to add captioning to virtual meetings that you're aware of?
It's definitely a challenge at the moment. It's a challenging area. I would say at present we haven't really got a nailed on answer for that, particularly for sort of the more popular video conferences that are there. All I would say is that those providers are very conscious of that and are working on this literally as we speak. So we picked this up recently as an issue. I touched on briefly in the presentation. We know that Microsoft Teams have added captioning to the Android and iOS systems. So there's a slight way forward there, in that that obviously organisations can encourage people to access remotely using mobile phone devices or tablet devices where they're either Android or iOS. So there's a slight light at the end of the tunnel with that one, but there is still some progress to be made to make sure there's better captioning available.
Great. Yeah, there is another comment in terms of Microsoft Teams being sort of having a bit more capacity over Skype. So I think that's sort of confirmed as well. I think that is the majority of questions. I'll sort of give it 20 seconds and if anyone wants to send any across. If anyone sent anything through, as I mentioned before, that hasn't been read out, it was probably very specific, so we'll answer that privately if that's okay, and we'll certainly get back to you today. Everything that we've gone through, we will send this out in an email later on today to everyone. If anyone's got any queries, questions, you can come. We'll put Adrian's details on there as well, myself. If there's any queries around reasonable adjustments, Assistive Technology licenses, etc., then again you can contact myself or Posturite or your sort of local contact, Posturite contact. Then that'll be great. Yeah, we will send the slides out, one or two asking for the slides, so we will send that out as well. Which, yeah, there's no further questions, so that leaves me to say thank you, Adrian, very much. Hopefully that was useful for everyone, and yeah, everyone take care, and yeah, speak to you soon. Thanks very much.
Cheers. Thanks, Andy.